Welcome to the Deep Dive. We've got some really interesting material today, focusing on something, well, pretty vital for everyone: healthcare quality and patient safety.
Absolutely.
We're going to explore this from the high-level standard for hospitals down to those really crucial moments.
Yeah.
The decisions you face right after leaving the hospital.
Yeah, that discharge period, it's often where safety measures really get tested in the real world. We want to connect the dots between what hospitals do for quality and how you, the listener, can be part of that safety net.
Exactly. So for this deep dive, we're drawing on info about major players like Joint Commission International, NABH in India, and also looking at how hospitals actually implement these standards, plus some really practical advice for managing care at home.
Our goal here is to, shed light on why these organizations aim so high with quality standards. And importantly, give you the tools to be a confident partner in your own safe recovery, especially when you're feeling vulnerable after a hospital stay.
Okay, let's jump in. So healthcare organizations talk about aiming for zero harm, highly reliable care delivery. I think that's JCI's mission statement.
That's right.
What does that actually mean for, the average person? It sounds good, but how does it translate?
Well, it's fundamentally about building safety into the system, not just hoping for the best, but designing processes, checks, balances, so that even if someone makes a mistake, which happens, we're human, the system catches it.
Like in aviation, checklists and stuff.
Exactly like aviation. Redundant systems, rigorous training, constant learning from errors. Healthcare is aiming for that same kind of reliability because, well, the stakes are incredibly high.
And this is where accreditation bodies fit in, like Joint Commission International, JCI, you mentioned them.
Yeah, JCI is a big one globally. They've been around for over 20 years, really focused on enabling and affirming the highest standards, as they put it, for everyone.
They basically set the bar.
They provide the framework, the standards, and then an independent evaluation. Hospitals measure themselves against these global benchmarks.
And it's a huge operation, 70-plus countries, over 1,000 programs accredited.
Supported by hundreds of experts.
And their standards, you mentioned the international patient safety goals, are key to this. What sort of things do they focus on?
Oh, really fundamental stuff. Things like making absolutely sure the right patient gets the right treatment. Sounds obvious, but errors happen.
Right.
Preventing surgical mistakes, like operating on the wrong site. Reducing infections people might pick up in the hospital. It's about nailing those critical safety basics.
So standardizing the essentials. And getting that JCI stamp isn't just for show, right? The sources mention real benefits.
Definitely. Internally, it drives improvements in staff training, teamwork, communication. Think about an emergency situation. Clear communication is vital.
Makes sense. That internal focus must have external benefits, too.
It does. It signals quality, which can be a competitive advantage. It builds trust in the community. And crucially, it helps manage risks better and fosters this deep culture where patient safety is just the priority. Number one.
Okay. And switching focus slightly, but still on accreditation, you mentioned NABH in India.
Yes, NABH, the National Accreditation Board for Hospitals and Healthcare Providers. It's part of India's Quality Council, QCI.
So similar goals, but focused nationally.
Pretty much. Setting quality and safety benchmarks specifically for India's healthcare system. Their vision mentions creating an ecosystem for quality, which I find interesting.
Ecosystem implies it's broader than just the hospital itself.
That's how I read it, yeah. Maybe looking at the whole patient journey, coordination of care.
Okay, so achieving these standards, whether JCI or NABH, sounds like a massive undertaking for a hospital. How do they actually manage it?
It's a huge effort. Often they bring in outside help, like specialist consultancies. The sources mentioned one, Supreme Medic Consultancy, as an example.
Right.
These firms guide hospitals through the whole accreditation maze planning, finding gaps, setting up quality systems, even things like staffing levels and operations management. They help turn those standards into, everyday practice for NABH or NABL for labs.
Wow, so there's a whole support system just to help hospitals get there. It really shows the commitment needed.
It's a major investment, yeah. Time, money, training.
Okay, let's pivot now. From the hospital systems striving for quality to you, the listener, perhaps leaving the hospital.
Yeah.
That discharge moment. Big step, but you're not fully recovered yet.
Exactly. And this is where everything we've talked about, the hospital's quality efforts meets your personal reality. That decision, do I need to go back? It can be really tough.
And scary.
And scary, yeah. Readmissions aren't trivial. They cost a lot, average $15,000, the source said, plus risks of infections, maybe even errors.
But waiting too long if something is wrong is obviously dangerous, too.
Much more dangerous. Navigating that is key.
So how do you know? How can someone tell the difference between I should watch this and I need to go back to the ER right now?
Okay, this is where the sources get really practical. They lay out specific readmission red flags. These are the things that mean seek emergency care immediately. Don't wait.
Okay, give us the red flags. What are they?
All right, number 1. Any new chest pain or pressure.
Got it.
Significant shortness of breath, especially if you're just sitting, resting.
Okay.
For surgical wounds, bright red bleeding that soaks through the dressing and doesn't stop, or foul-smelling pus coming from the wound, plus a fever over 101 Fahrenheit, that's about 38.3 Celsius.
That sounds serious.
It is. Also, sudden confusion, disorientation, trouble speaking clearly, or sudden weakness, especially on one side, could be a stroke.
Right, classic stroke signs.
And finally, pain that's just out of control, not touched by the pain medication you were prescribed.
Those are clear signals for immediate action. What about things that are worrying but maybe not ER-level emergencies, the wait and watch category?
Right. These are things you definitely need to address, but the first step should usually be calling your doctor's office. Examples include a low-grade fever, say 99 to 101 Fahrenheit, without those other big red flags. Minor wound drainage, maybe clear or yellowish, without a bad smell. Feeling a bit dehydrated often, you can try drinking more fluids first, following your doctor's advice, of course.
Makes sense.
Or common side effects from a new medication, like a bit of nausea or a mild rash. Again, call the doctor.
And the key message there is call first. How should people approach that call?
Be ready. Know your symptoms. Use specifics. My temperature is 100.5. The red area is about the size of a quarter. Describe any drainage color, smell, how much.
Give them the data.
Exactly. And then ask directly, based on this, can I manage it at home or do I need to be seen? Teleconsultation might even be an option now for some of these things.
Yeah, that could save a lot of hassle if it's not an emergency. Now, what mistakes do people make that might actually lead to needing readmission, the preventable traps?
Yes. The sources pointed out a few common ones. There's the I'll just tough it out approach.
Guilty as charged sometimes.
We all are. Ignoring symptoms, hoping they'll vanish. Big mistake sometimes. Another huge one, not fully understanding discharge instructions. One source said 60% of people forget activity restrictions.
60%. Wow.
Yeah. And medication mix-ups, skipping doses, wrong times, confusing old meds with new ones, that's really common.
Trying to do too much too soon.
That's another one. Premature independence, pushing yourself physically before your body's ready. And lastly, skipping follow-up appointments. Those are there for a reason.
Okay, knowing these traps helps avoid them. What about a positive checklist? Things you could do at home for a safer recovery.
Okay, practical steps. First, the 24-hour rule. Have someone stay with you or check in often for the first full day home. That's a key monitoring window.
Good idea, like a buddy system.
Exactly. For meds, use a pill organizer, the 7-day kind. Set alarms on your phone. Don't rely on memory alone.
Smart.
Hydration. Aim for at least 6 cups of fluid a day, unless the doctor said otherwise.
Okay, and movement. People are often scared to move after surgery.
Gentle movement is usually good. The sources suggest walking for maybe 5 minutes every couple of hours. Helps prevent blood clots. But, and this is crucial, no heavy lifting. Avoid that premature independence trap.
Right.
And finally, post key phone numbers, doctor's office, discharge nurse lines somewhere visible, like the fridge. Old school, but effective.
Definitely. Makes it easy when you're stressed or not feeling well.
The core message through all this is, if you're unsure, call your doctor first. Give them clear info, have your discharge papers handy, your med list. Make decisions based on facts, not just fear.
Okay, let's quickly circle back to the hospital's perspective. Why are they so focused on reducing these readmissions? We know it costs money, but is there more to it?
It's a major quality indicator for them. High readmission rates can signal problems with the care itself, or often with how well the discharge was handled.
Okay.
Plus, there are often financial incentives or penalties. In the U.S., the CMS program directly links payments to readmission rates for certain conditions.
Money talks.
It certainly gets attention, but it's also about improving that whole transition. Was the discharge planning good enough? Did the patient get timely follow-up? Were they maybe sent home too early? It connects back to that whole system quality we discussed.
It really is an ecosystem, isn't it?
It seems so, yes. And the sources mentioned data from Canada show 1 in 11 patients readmitted within 30 days back in 2021. It's a significant issue everywhere.
Wow. And briefly, what about patient rights during this process, especially if you do end up back in the hospital?
Yeah, a couple of points came up. You can usually ask to see your original care team again, if possible.
That could be reassuring.
It could. And you can also ask for a case manager to help coordinate things,
Yeah.
especially follow-up care after you leave again. And for caregivers, their role is just massive.
Absolutely.
Monitoring, taking notes, helping with meds, transport, and crucially, being the patient's advocate if they can't speak up for themselves. They're a vital part of that safety net.
This has been really useful. We've gone from the big picture hospitals aiming high with quality standards like JCI and NABH, right down to the nitty-gritty of what you can do after discharge.
And it really comes down to that combination, doesn't it? Knowing the serious red flags, using your doctor as a resource for the less urgent stuff, and just being diligent with those discharge instructions and follow-ups. And importantly, not letting cost worries stop you from getting emergency care when you truly need it.
It really highlights that quality healthcare is a partnership. The systems, the accreditation, the processes they provide, the framework.
Right. They aim for zero harm.
But the patient, the caregiver, you are essential links in that chain, especially during that vulnerable time transitioning home.
And maybe a final thought to leave people with. Think about how those high-level goals like the international patient safety goals, improving communication, preventing errors, how they directly relate to the simple steps you take at home.
Like using a pill organizer or knowing when to call the doctor.
Exactly. It's about bringing that quality focus down to your personal recovery. And like one of the sources said, and it's worth repeating, when in doubt, seek help early. It's better to check once too often than too late.
Couldn't say it better myself. Thanks for joining us on this deep dive.